Commissioner, please convey our greatest appreciation to the Prime Minister and the Government of Australia, but more importantly, the people of Australia, for continuing to stand in our way. This will, in effect, at this juncture, let me invite you to the podium for you to reciprocate with your response. But look, on behalf of our citizens, I thank for this 8,000 that has come in, and I also thank for you putting and advocating for us to be leapfrog hired into the queue to secure additional 1 million that should come on top of what WHO and other partners are securing for us as vaccines to be made available in country to be used for those who need to be vaccinated. Thank you very much.
I'm being drowned in microphones. Thank you, Prime Minister. Okay. Avanun Truogera. Thank you very much, Prime Minister, the Honourable James Marape, Prime Minister of Papua New Guinea. I should acknowledge too the Minister for Health, the Honourable Jelta Wong, the Minister for Agriculture, the Honourable John Simon, the Pandemic Control Commissioner, Manning Secretary Nico of the National Department of Health, Vice Governor of NCD, the Honourable Daddy Toka. I should also mention today too are very strong partners in supporting the Government of Papua New Guinea, which is the representative of WHO, Ms. Anna Malson, and the representative of UNICEF, Mr. Claude Kamenga, who are incredibly important partners for us and for Papua New Guinea in this rollout. I'm very proud to be here today, Prime Minister. For us, it's very important for us to be helping Papua New Guinea in all these instances. And the way we're most pleased to do that, that's most important to do that, is first to listen to Papua New Guinea, to understand what Papua New Guinea wants, and to discuss with the government and the health authorities what their needs are and what we can best supply. So it's in that context that we're able to be here today to provide the first most urgent need of 8,000 doses to be provided for the frontline health workers identified by the Government of Papua New Guinea and other categories of people the Government has decided upon. As the Prime Minister said, it's very important that those people be the needles for inoculation, the containers for disposing of the needles, even the band-aids for after people have been vaccinated. Together with them on the plane, the Royal Australian aircraft plane that arrived today, we brought the first AUSMAT personnel. That's Dr. Mark Little, who was the AUSMAT leader in the very first AUSMAT deployment in August last year, the clinical lead, Dr. Angie Jackson, and a couple of days also we have Professor Piers Barnett, who also came then. They will work very closely with PNG authorities to understand how we can best support PNG's efforts, and then work with our authorities to bring back what we expect will to be a further AUSMAT larger clinical response team who will come a little bit later on. Also on the aircraft today is additional support with 3,000 GenExpert cartridges to enable further testing, because we know we need to do more testing in Papua New Guinea to understand really what the situation, though we know it's not good. Additional portable warehouses to store the vaccines and other medical equipment, tents to allow better storage of all these facilities and further rollout of the vaccination. So all these, together with the PPE which is arriving, announced by my Prime Minister and my Foreign Minister last year, is the very first, very fast assistance. It's the first step in what we know is going to be a long, serious, difficult effort for the Government of Papua New Guinea, which we need to be able to support them together with WHO, together with UNICEF, with the other partners. Prime Minister mentioned the Quad partners, India, Japan, US, France and New Zealand are also stepping in. New Zealand very recently with an aircraft supply of PPE, and France too, I know, is coming to assist. So together we want to provide all the possible help we can to the government of Papua New Guinea, ministers, public health system, to do everything they need to do to inoculate Papua New Guineans, but also to support the health system to be able to continue to assist Papua New Guineans, not just to help with COVID-19, but all those other routine vaccinations, all of that other daily health care that the health system is trying to provide throughout this country. And we need to keep that operating throughout the period. So I'm very pleased to be here to announce that. I'm very pleased to say we will stay to continue to help provide more assistance and more aid along these lines together into the future. We will be here and supporting Papua New Guinea. Thank you, Prime Minister. Thank you, everyone.
All right, we'll take a few questions if there are few questions to take. You can shoot the questions to any one of us. Even the Health Minister here, Controller Health Secretary, myself, Agriculture Minister for any more quarantine, as well as all of us here. So any questions, please, anyone? All right, if you don't mind, we will, as I said, the medical and scientific community will sit tomorrow morning with the Health Secretary and the Controller, and they will go through the 8,000 vaccines we have here to ensure that we map out who are the essential people who need to be vaccinated, and then hopefully next week we start to roll out. We got hotspots in our country, the border provinces, and we also have Port Moresby as a hot spot. We also have we're quite concerned in areas where there are movements that does take place in ship or in PMVs or in plane. That's why we have this isolation, 4 weeks of isolation going now, where Police Minister and Police Commissioner will start to operationalize stopping people from moving unnecessarily from place to place. As you know, Air Niugini still flows and airlines PNG still flies in, but only essential, those who qualify as essential travelers will now be asked to travel, and we will go into the detailed protocols of ensuring that you have medical records in as far as attached to your traveling going back and forth. So those are some of the nitty-gritties that we will be engaging upon to go into living with COVID-19 going into the future. This 8,000 will be distributed based on a plan they will come up with. Hopefully, as I said earlier, the health workers, it's not compulsory, but the health workers will be asked to take it. If a health worker knows that you're exposed, you want to take it, you take the vaccine. First and foremost, it's for all our health workers. I did indicate earlier, there's one renowned doctor who left PNG. He should be here if the vaccines was here earlier, but he's left to go to Australia just to get himself this vaccine from this vaccine, and then he will be on his way back. So we want to make this available for doctors as early and medical workers as early as next week. What we will do is this 8,000 we will give to 8,000 person. In fact, you're supposed to have back-to-back two hits in as far as dose of vaccine is concerned, but we're very sure with our partnership with our United Nations family of organizations in our country, including UNICEF, as well as WHO. I think there are beds of help coming in possibly 1 month time, 2 months time. They did indicate to us in possibly as early as April. So with this, we will spread it to as much as we can, 8,000 Papua New Guineans and essential, those who are residing with us, but essential frontline workers and those exposed to COVID-19. When the next batch comes from either WHO, UNICEF, we'll ensure that they pick the second dose, as well as the others who will come in. So in between now and the next supply, possibly a month or 6 weeks or 2 months, that's enough for the window for these people, this lot, to those who've taken this first shot to take the second shot. And hopefully within the next 3 or 4 months, we would have more than 1.5 million or so of vaccine supplies in country for us to ensure we spread this out throughout our country. Australian High Commissioner can respond, but as far as I know, and from the doctors who've been advising me, most Australians have been vaccinated. Most Australians who are with us here in country working have been vaccinated themselves. So, and this is the vaccine that they've sought themselves with. So, I may be wrong, but High Commissioner. So, from advice, that's what I've been advised. Yeah.
I think you're right, Prime Minister. Our rollout is still the Australian. They're most of the way through. From
Looked at what was happening in Australia, we held back until we are absolutely certain that for PNG, this is the vaccine that is best, can be taken in and available for us to use. And as I said, for those of you who don't want to take vaccine, and if you feel you're a superhuman being, we will have the isolation strategy that police will deploy and use. And if you found to be COVID positive, your freedom for 2 or 3 weeks can be lost. We will pick you up, we lock you away. That's the sort